Early on shift in the West Midlands ambulance service, and already there's a call. Paramedics Claire and Kelly are dispatched to someone who's been waiting 7 hours for an ambulance, although it is a non-critical case.
Hello, it's the ambulance.
Winter is always busy, but there's added pressure this year. A Sky News investigation by the data and forensics team has revealed that NHS regional boards are overspending hugely. We made freedom of information requests to 42 integrated care systems, or ICSs, in England. They're responsible for allocating the NHS budget and commissioning services in their area. 41 ICSs replied, and all are in deficit. As of September, 6 months into the current financial year, England's ICSs had overspent by an estimated £2.45 billion. The forecast from the ICSs is to improve that situation, the line going up, even if it's still not at break-even. But our analysis suggests that things will in fact get worse, the line going down, with ICSs spending £4.9 billion more than planned by March next year. This call is a simple one in the end, but it still requires a trip to Warwick Hospital.
It doesn't seem to ever ease off at all. It puts pressure on us all. We're often waiting outside the hospitals, and it delays us getting out to help patients.
We've been riding with Claire and Kelly to see how one of those pathways, a new technology called Consultant Connect, is being used to keep elderly patients out of hospital. Patients like Joyce, who's 90 years old and had a fall this morning.
I'm Kelly. Kelly, it is.
When the paramedics arrive, after they assess the patient,
Heart rate is 87.
they're connected to an expert back at Warwick Hospital. They advise them on whether the patient needs to come into the hospital, and they can also send a specialist team to the patient's home.
Take care, sweetheart.
That means that Joyce can stay at home today, which means more time back on the road to help more patients. This job is high pressure, high demand, but it's also what the NHS looks like just standing still to meet current needs. Our report shows the financial pressure that the NHS is under. And the worry is that money meant to be spent on improvements for tomorrow is instead spent today, so that standing still actually becomes falling behind.
Funds that were actually there to help the NHS become more productive, to see patients quicker or to treat them more efficiently. For example, investing in technology or fixing buildings which are literally crumbling. That money has been diverted to fill the gap in just paying for the day-to-day services.
Frontline services like these simply have to be paid for. But it means that the NHS is constantly spending on today's crisis, which means that the one that comes tomorrow will be even tougher to deal with. Tom Cheshire, Sky News, Warwick.